Hi everyone, my name is Jeannie Wijaya. Today I'm going to share with you my experience interviewing a clinical nurse informatic at my hospital. Her name is Rachel Tyra. She is a very cool lady, easygoing person. Um, so I know her from my friend actually. My friend, the one who introduced me to her, she worked at IT department in my hospital. When I approached her, I asked whether I'm okay to do the interview for my school project, and then she's very excited and she's willing to do in person. So I did interview her in person. We went to a cafe and we kind of like um, share a few things. I asked a few things with her. She mentions that she was a psychiatric nurse before she became a clinical nurse informatic. She's been working for 10 years in the hospital, but then she worked maybe about 3 years as a psychiatric nurse, bedside nurse. Then she moved to the clinical nurse informatic. I asked her why you have to move if you like being a psychiatric nurse in the beginning. So she said like, oh, before I become a psychiatric nurse, I already kind of like the technology. I like computer. I like everything related with the computer, data, and everything. I was a super user in my unit. And then when the job opened in clinical nurse informatic, I was excitedly moved to that unit. Then um, she said she's happy. She shared with me that being a clinical nurse informatic actually it's fun and also challenging for her. She shared she shares some information that she works with a lot of people in the hospital, like provider, doctors, social worker, patient bed flow management, and then physical therapy, occupational therapy. She even mentions to me that uh, the value of having informatic as part of nursing care is very important because nursing informatic is the one that integrates, manage, and communicate all the data, research, and knowledge into the practice. She emphasized that the technology, the value of the informatic itself actually is to help the provider and the nurse to do the patient safety at bedside care. So it's not to replace the nurses, but also actually it's to help us to do the patient's care. She mentions to me about a big project that she has to do uh, from when they have to move one hospital, combine it to the same hospital facility. Then all the IT department has to deal with that, how to transfer all the data, how to make all that possible to work. So she also mentions to me, surprisingly, um, it's kind of like amazed me how she said that each person only dealing with one data. One person's in her unit actually assigned for one item, like the data. For example, her job is to handle the data for patient flow, teletracking. Teletracking is the one that assigned for the admissions, transfer, discharge. So it's accurately timestamp that's the time when patients admitted, why patient has to be admitted, all the reason, all the time and everything has to be accurately documented. So with all the system that looks like click just by click button, actually we already did all the documentations as a data that they need to collect. So she only deal that one thing, but for other people dealing with the other thing, each unit she mentioned that we have, uh, let's say we have operating room, emergency room, we have critical care ICU, we have pediatrics unit. All those unit has specifically different layout, has different needs, different item of documentation that they have to itemize one by one. It's crazy, right? Because like for me, I come to work and then like, oh, this is the system. Okay, let me just use, let me click, click, click documentation, and then that's it, done. But actually, behind that, they have to work all the details, all the itemized item for us before to make that all happen. And the system itself is not cheap. uh, it's millions dollars actually for item. For I remember she also mentions that when we have to go a magnet journey, they change a few items details of the documentations in the cerner, and that is required a lot of budget to do the changes, a lot of adjustment, and then they also have to do training the peoples that they gonna who gonna use the item itself. So it's really like a hassles, but in the end, it will be aligned perfectly after that. So that's kind of like interesting for me. That's kind of like amazing for me. See, I feel like this really really give me an idea that as a master prepared nurse in the future, I'm gonna be a provider. I have to know when patients, when we deal with the patients with the past medical history, and then we have to assign the to the social worker or to the home health after that. So we not as a provider, my mindset supposedly prepared to be itemized. It's not just care at that moment, but also in the long run after that, after patients discharge and patients go home. So with this interview, actually, it's given me an idea. It give me a big insight. From before, I only think individual patient care. Now I more onto the system level of care. I see as a bigger picture as a hospital process from the admissions until discharge and after that when patients go home. So it's more like a system level practice. So I think it's a good thing that I know this. This is opened up my mind first, and I hope that you guys have a good insight as well. That one item I that in the system, in the documentations, in the scan for medication, actually that is a lot of things to do behind that before it's happened. So I really appreciate what the nurse informatic do for the nurses. So I hope this interview also benefit for you guys to know that actually clinical nurse informatic job is fun and challenging. It has some different thing than the bedside nurse. So thank you for listening and have a good day. Bye bye.